Hi, I'm Dr. Christopher Palmer. I'm a specialist in robotic total joint replacement surgery. And if you've just had total knee replacement, we need to discuss what the post-operative instructions are. We place a bandage in the operating room. The operating room is a sterile environment, and the bandage we place is a special bandage that actually will kill any bacteria that tries to enter into your knee. That bandage is designed to stay on your knee for the first 2 weeks. And then at 2 weeks, we'll change the type of dressing to just gauze and tape. We give you an extra bandage for emergency purposes only. Those emergencies may be if the bandage comes off, if you get water underneath the bandage, or you bleed through. Otherwise, we want you to leave that bandage on for the 2 weeks. During the first 2 weeks after a knee replacement is when your inflammation and swelling will spike. If you do too much, the swelling will get worse. If you don't do enough, you'll get really stiff and you'll lose range of motion. During those first 2 weeks, we want you to rest it and ice it and elevate it as much as you possibly can. We want you to elevate your leg above your heart, and we also want you to elevate your leg as straight as an arrow with no bend in it at all. And like I said, keep the ice on it 24 hours a day, pretty much. We'll also give you a machine that helps bend your knee. We want you to use that machine as directed. Don't do any more with it or any less with it, but just follow the instructions. The other important thing is physical therapy. And I tell all my patients that physical therapy is extremely important. If you don't do it, you'll regret it. Only you can do it and no one's gonna do it for you. If you don't do it, you'll get stiff, it'll get painful, and you won't like your knee replacement. It won't be worth doing all this if you don't do the hard work afterwards. We want you to get up every hour you're awake and walk, even if it's just to the bathroom or to the kitchen. We only want you walking about 1,000 steps a day for the first 2 weeks. Doing that's gonna help prevent blood clots, pneumonia. It's also gonna keep your knee moving so it doesn't get too stiff. Other things are making sure you take the medications as directed. We will give you a medication for a blood thinner. That blood thinner is vital and you have to take it as directed. Also, we'll give you pain medication. We're trying to avoid narcotics if possible. We give you other medications that'll help avoid narcotics. We know narcotics are necessary, but we try to keep them only for the first several weeks. The first few weeks are hard, but it will get better with time. By 6 weeks, you'll be happy you did it. And by 3 months, you'll be looking through that rearview mirror and moving forward. We're obviously there for you if you need us. You can always call us. You can always come in early if you have any questions or concerns. And I can be your trusted guide through this process and help you through, answer any questions you have. A knee replacement is tough, but I've seen countless other patients go through it. And I want to encourage you that you can do it too. We've done this many times. If you follow our instructions, it will keep you safe, it will protect you, and it will help you along the way.